This is Dr. Moein, Century City, Beverly Hills. I'm a board-certified general surgeon specialized in bariatric surgery and weight loss. Today, we're going to go over most frequently asked questions in regards to weight loss surgery and weight loss medications. What is bariatric surgery? Bariatric surgery is a set of procedures that are designed to improve health and well-being of patients with obesity by reducing the weight and allowing the patient to have less hunger in order to be able to tolerate the weight reduction. What types of bariatric surgery are available? The types of bariatric surgery that currently are available are restrictive versus malabsorptive operation. Restrictive operations are generally operations that restrict the amount of food that you can eat at any one time. These are operations by restricting the size of the stomach, such as the gastric sleeve operation. It creates a nice narrow sleeve, restricts the amount of food that you can eat at one time, or the gastric bypass operation, which limits and creates a pouch out of the stomach, restricting the amount of food, again, that you can eat at any one time. Although the gastric bypass is both a restrictive and a malabsorptive operation, but it functions initially very strongly as a restrictive operation that implies its initial strong weight loss. How much weight will you lose after surgery? The amount of weight that you lose after surgery is really dependent on the type of surgery that you choose. It is important to spend a lot of time with your surgeon to understand these surgeries, because the amount of weight is not only dependent on the type of surgery, but also dependent on your own behavior and whether that surgery is appropriate with your behavioral issues that implies on your life, so you are able to choose the right surgery in the right circumstance of your life and the right behavioral modification that you need to have in order to have a successful surgery. How long does a surgery take? The gastric bypass operation takes longer to perform than the gastric sleeve operation. The gastric bypass operation typically takes around 3 hours to perform. The gastric sleeve operation takes under 1 hour to perform. Both operations are safe, effective, and they have sustainable long-term results. Now, the reason the gastric bypass takes longer to perform is because the gastric bypass has multiple segments of the operation. The initial part of the gastric bypass is creating a restrictive pouch, creating a pouch. The secondary part of the bypass is rerouting the small bowel into a bypass segments and reconnecting the small bowel on the last part of the operation to create a nice continuous flow of food through your gastrointestinal tract. The gastric sleeve operation is just one segment, and that allows to create a nice narrow sleeve, and that's why it is much less time to perform the operation. Again, with the gastric bypass operation, you have 3 phases of the operation. With the gastric sleeve operation, you have only 1 phase of the operation that allows you to perform it effectively and efficiently. How long do I stay in hospital after surgery? The typical timeline for staying in the hospital after surgery is 1 to 2 days. Most of our bariatric surgeries are actually now performed in the outpatient surgical setting, and those patients do not need to stay in the hospital. Most bariatric surgery has now become an outpatient surgery. That means your surgery is done in a surgery center and you can go home afterwards. The reason that we're able to deliver this type of care for our patients and our patients can go home is because statistically, when we looked at all the patients that end up having bariatric surgery, we realized that in our hands, we can perform the surgery without any complications and the patients can go home. In specific subset of patients that we know that they are higher risk, whether they have higher BMI or associated comorbidities such as heart disease, lung disease, then we keep the patients inside the hospital. These patients are typically preoperatively optimized for their issues, so we know that they're safer to be done inside the hospital. When can you return to work after surgery? The time frame to return to work after surgery depends on the type of work you do, depends on you, whether you're self-employed or you work for a big company. Those questions are very critical to understand, and the relevance of it I want to get into. First of all, if you work for yourself, I've seen my patients be able to return back to work the next day after surgery, because you can control and limit the type of work that you can do, and you can essentially dictate whether you can get out of work early or not. But in overall patients that are employees, it depends on whether you have a desk job or you have a job that requires physical work. I tell my patients, limit the heavy lifting to 5 to 8 pounds after surgery for at least 3 to 4 weeks after surgery. If that's something that your job requirement is, then maybe you can choose to have a type of position during that interval time that is more sedentary and desk job. But if you're needing to lift heavy things, you need to wait at least 3 to 4 weeks before you end up doing these things, because you can minimize the risk of having hernia formation after the surgery. What kind of anesthesia is used during bariatric surgery? The type of anesthesia used during bariatric surgery is general anesthesia. General anesthesia is often supplemented with local anesthesia called transversus abdominis plane block. That is a type of anesthetic infusion that allows you to, even after you leave our practice and go home, that type of block allows you to go home safely and have minimal amount of pain in the first 12 to 48 hours after surgery. Will you need blood transfusion after surgery? The chances of you needing blood transfusion is slim to none. Over the past 20 years that I've performed this operation, I've only given blood to one patient. This is in thousands of patients that I've interacted and provided care for. So you can imagine the chances of you needing blood transfusion is extremely low for most patients. How long will it take for you to be able to have regular diet? The typical time frame to get to regular diet is around 4 to 6 weeks after surgery. The first week after surgery, our patients are often on liquid diet. The second week after surgery, our patients are on puree diet. The third week after surgery, our patients are on soft diet. In the fourth, fifth, sixth weeks, the patients slowly introduce solid food into their diet. The reason that we take this time frame to progress your diet slowly is because of two things. One is we want there to be no tension, no obstructive events where you eat something big and it gets caught in the new connections. Two, to allow you to slowly acclimate to the new stomach and the new size and the new flow of food that you have. And lastly, importantly, is to allow everything to heal while all this is happening. What dietary changes do you need to make after bariatric surgery? The dietary changes that you need to make after bariatric surgery are multiple. Most importantly, you need to be mindful of your eating habits. What's lovely about bariatric surgery, it really provides its own control. What do I mean by that? At the essence of every type of obesity issue is hunger. Bariatric surgery really controls the hunger. By minimizing hunger, it helps you make better choices and more mindful choices for you. The type of changes that we expect you to make is to cut out all the complex fatty food, carbs, and sweets that is really not good for you. It is so interesting. Most of my patients come in after surgery and they'll tell me they have no taste for these medications. And that is really why this surgery is effective. What's important and upon you as a patient is to take that tool that is being given to you and use it appropriately. Will my insurance cover bariatric surgery? Insurances can cover bariatric surgery. However, they have specific criteria that you need to meet in order to be able to undergo bariatric surgery under insurance. If you have out-of-network PPO insurance that allows you to have bariatric surgery in outside facility, you can come to us and we will sit with you and carefully plan on how to meet the criteria and ensure that you find coverage and let you know what your out-of-pocket cost is, so you can have a safe bariatric surgery under your insurance plan. How soon can I start exercising after bariatric surgery? Typically, our patients are able to exercise within 1 week after bariatric surgery. That's light exercise. I encourage my patients to start walking and make sure that they do some light exercises, because that is exactly why you had your surgery, to change your lifestyle, to give you the ability to effectively lose weight while doing your exercise. Most patients after their bariatric surgery, they're able to start going to the gym within 3 weeks after bariatric surgery and do heavy exercises within 4 to 6 weeks after bariatric surgery. Can bariatric surgery help with conditions such as diabetes and high blood pressure? Bariatric surgery helps with conditions such as diabetes, high blood pressure, high cholesterol, heart disease, and even infertility. It is remarkable how one surgery can make such a difference in all these different types of medical illnesses. At the heart of this issue is metabolic syndrome. Metabolic syndrome is what encompasses and feeds into all these problems. And when you lose weight, your body automatically resolves all these issues or significantly improves these issues. Most patients who undergo bariatric surgery, up to 60 to 70% resolution of diabetes. Most patients with high blood pressure, hypertension, will end up coming off of multiple medications for their blood pressure and either completely stopping their blood pressure or reducing their medication significantly to one medication, making it much easier for them to manage. And in terms of heart problems, even patients with heart failures, I've seen many patients who previously their ejection fraction was in the 20s, and after bariatric surgery, because the bariatric surgery significantly improved their overall health with the weight loss, it decreased their peripheral resistance and improved their heart function and allowed them to be a lot more healthier and able to engage in activity after bariatric surgery because of their weight loss. Is bariatric surgery a quick fix for weight loss? Bariatric surgery is not a quick fix for weight loss. It requires dedication. It requires selflessness to make a decision and understand that you're up against a very difficult medical condition and you need to make a decision in order to be able to get treatment. Bariatric surgery is very complicated, requires a significant amount of steps that you have to go through in order to be able to obtain the surgery. After the surgery only functions as a tool for you to be able to lose the weight and to be able to be successful. It doesn't do the whole thing for you. Most patients that have undergone bariatric surgery, they have now been given a tool that allows them to have a fair fighting chance against a medical condition. Unfortunately, the public and even the medical community still looks at obesity as not a disease and a choice that people make. It's critical for us to understand this as a medical condition and to be able to provide the medication, the tool for patients to lose weight and not look at this as a quick fix in any way.